Hello, my name is Lilia, and in this video I will be instructing you on how to properly perform skin fold measurements. First, I want to provide you with a little bit of background about skin fold measurements. It is known that approximately 1/3 of fat is located subcutaneously. However, subcutaneous fat proportion values vary with sex, age, and race. Therefore, equations used to convert skin fold sums to body fat percent need to consider these variables. Factors contributing to measurement error include poor technique or inexperienced evaluators. Also, extremely obese or lean individuals can contribute to measurement error. Improperly calibrated calipers can also contribute to measurement error. Prior to beginning your skin fold measurements, you should make sure that your calipers are properly calibrated. The caliper should be placed directly on the skin surface, with the prongs approximately 1 centimeter away from the thumb and finger, perpendicular to the skin fold, and halfway between the crest and the base of the skin fold. The pinch should be maintained while reading the caliper. Wait 1 to 2 seconds, no longer, before reading caliper. When taking the pinch, it is important to gently tug the tissue away from any muscle in the testing site. This will allow you to better measure subcutaneous fat. All measurements should be made on the right side of the body with the subject standing upright. The first skin fold site that we are going to be going over is the tricep. This is what a proper pinch on the tricep should look like when you are measuring the skin fold site of the tricep. When measuring the skin fold site of the tricep, the pinch should be made with the vertical fold on the posterior midline of the upper arm, about halfway between the acromion and olecranon process, with the arm held freely to the side of the body. Now we will be going over the subscapular skin fold site. This is what your pinch should look like when you are measuring the skin fold site of the subscapular. When measuring the subscapular skin fold site, you want to make the pinch at a diagonal fold at approximately 45-degree angle, around 1 to 2 centimeters below the inferior angle of the subscapula. If necessary, you can have your client wing the arm to find the inferior surface of the subscapula. Then you can move your fingers over 1 to 2 centimeters and take the pinch at a diagonal fold. Hold the caliper again for no more than 2 seconds and record the reading. When measuring the chest or pectoral skin fold site, you want to pinch at a diagonal fold, about 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. Take the pinch and again hold the calipers no longer than 2 seconds and note the reading. The next skin fold site we will be going over is the mid-axillary skin fold site. This is the way your pinch should look when you're measuring the skin fold site of the mid-axillary. When taking the measurement of the mid-axillary skin fold site, you may want to ask your client to hold up his arm to better find the site. Then you can take the pinch at a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid or sternal border in the mid-axillary line. Once you take the pinch, place the caliper on the skin site and hold for 1 to 2 seconds and take your reading. The next skin fold site I will be going over would be the abdominal skin fold site. This is what a proper measurement would look like when you're measuring the abdominal skin fold site. When measuring the abdominal skin fold site, you want to make a vertical pinch to create a vertical fold that is approximately 2 centimeters to the right side of the umbilicus. Now I will be going over the suprailiac skin fold site. This is what a proper measurement would look like when you're measuring the suprailiac skin fold site. When measuring the suprailiac skin fold site, you want to make the pinch at a diagonal fold in the line with the natural angle of the iliac crest taken in the anterior axillary line, immediately superior to the iliac crest. The final site that I will be going over is the thigh skin fold site. This is what a proper pinch and measurement of the skin fold site should look like. When measuring the skin fold site of the thigh, you want to make sure that your client has his complete weight placed on the left side of his body, which is on his left leg. Then, you want to make sure that you take the pinch at a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease. Take the pinch and hold 1 to 2 seconds for the measurement. Using the skin fold measurements obtained, you can plug them into the 7-site formula. This will convert the sum of the skin folds to percent body fat that would consider the variables mentioned earlier for great accuracy of body fat percentage. There are 2 different formulas, one for men and one for women. With the body fat percentage obtained from the 7-site formula, you can categorize your client into one of the following categories. Each chart is different for men and women. Once categorized, you can go ahead and recommend any lifestyle modifications necessary to better improve the patient's fitness. All of the previous instructions and charts have come from the ACSM's Guideline for Exercise Testing and Prescription, 9th edition. I hope you enjoyed the video. Thank you very much.